video, I'm going to talk about how to take care of your late preemie baby at home after discharge from the hospital. There is a good reason why this group of babies are called the Great Pretenders. Do you know why? Because these late preemies can look like full-term babies. They can have the weight and the length of a baby born at term, which is possible, of course. They only look that way, but they act differently. Don't be deceived by what you see. Their brain and their organs are still immature and don't function as well as compared to what a full-term baby can do. Hello parents, this is Nurse Cherry and welcome to Mother Baby Central, where I share valuable content on how to take care of moms during pregnancy and postpartum period and babies during the newborn stage and first year of life. For everyone to understand the flow of our video for today, I am going to talk about the 6 main concerns you need to focus on and how to give the appropriate care at home for each one. These 6 areas are the most critical aspects to monitor in the late preemies, and in knowing so, we can prioritize the care needed by this special group of babies. By the way, to establish what a late preemie baby is, these babies are the ones that are born between 34 weeks and 0 days to 36 weeks and 6 days gestation. So, if you're all ready, let's get into it. Number 1, breathing. A baby's breathing pattern is irregular. If you look closely at the chest and the abdomen, you will see the irregularity of the breathing, wherein the breathing appears regular initially, and then they breathe fast, one after the other, then slows down again. Although the pattern is irregular, the breathing is effortless, meaning there are no signs of working hard to breathe. What are the signs when the babies are working hard to breathe? First is what we call retractions, where the baby uses accessory muscle in the chest to breathe. You will see the ribs pulling in and out during respiration. What else? You will notice grunting, where you will hear a soft whimper sound at the end of each breath. You might also notice flaring of the nose, which indicates they are working more to get more air into their lungs. What you need to be watching for also are periods of apnea or cessation or absence of breathing. You see, the late preemie's lungs are not fully developed. Therefore, they don't function properly. There is decreased surfactant as well as poor muscle tone in some parts of the respiratory system that predisposes these little ones to periods of apnea and respiratory distress. What do you need to do? You need to be very familiar with the symptoms I mentioned and learn how to recognize them. These symptoms need to be reported immediately, and in most cases, further evaluation by a doctor is warranted ASAP. Therefore, make sure you have your pediatrician's contact number and know how to contact them after office hours. If you have not seen your pediatrician yet, you can call the hospital where you delivered. They have your baby's medical record and they can pull out all the information they need to give the appropriate care. There is a big but to this. If your baby looks blue and is not breathing, call 911. If you have CPR training for babies, start CPR immediately while waiting for the paramedics to arrive. Never drive to the emergency department with an unresponsive baby. This will just cause more harm and risk to you and the baby and delay the proper treatment needed. Next, follow the recommendations to prevent sudden infant death syndrome. Your baby should be sleeping on the back, never on the stomach or on the side. Your baby should be sleeping alone in a crib. No pillows, no heavy blankets covering them, no stuffed toys, no hats, no crib bumpers. Review the Safe Sleep Guidelines from CDC and the American Academy of Pediatrics. I made a video about this and you can follow the link in the description below. Number 2, temperature. Late preemies don't have enough body fat on their bodies to keep them warm. Not only that, they have larger surface area to mass ratio and they lose heat faster compared to adults due to their immaturity. They don't adapt well to temperature changes. So what happens if their temperature drops or they get cold? they're going to work harder to warm themselves by using more energy and oxygen, which in turn compromises the other organs to work harder to conserve the energy they needed to help them grow. What do you do to maintain the baby's ideal temperature? Let's dive into it first. You have to know what the normal temperature is. The normal temperature taken axillary or under the arms is between 97.7 degree to 99.5 degree Fahrenheit or 36.5 degrees to 37.5 degrees Celsius. You need a digital thermometer at home to do this. Check your baby's temperature for the first few weeks after birth, especially before and after a bath, when the baby's skin is hot or cold to touch, when your baby seems irritable, when your baby's sweating, or when you feel something is not right. It is better to be sure than second guess, right? Do you know how to take an axillary temperature? It is pretty straightforward. Turn the digital thermometer on, lift your baby's arms and make sure it is nice and dry. Place the tip of that thermometer under the arms and hold the arms as close to the side of the body as you can. Wait for a few seconds, and then when you hear the beeping sound from the thermometer, remove it and read the result. Clean the thermometer with an alcohol swab after each use and keep it in a designated place. Next intervention for maintaining temperature, skin-to-skin contact. Either mom or dad can do this step. This is the best way of keeping your baby warm. Great to do after bathing your baby. Skin-to-skin has other great benefits too. It promotes bonding and helps a lot with breastfeeding. Probably one of the most misconceptions when keeping your baby warm is putting layers of clothing on them. That is totally false. Do not overbundle or put too many layers of clothing on your baby. This will cause overheating, where the skin feels warm to touch, sweaty and flush, heart rate and breathing is fast, and the hair feels damp. When you overheat your baby, they become less active, irritable, and have poor sleep. The appropriate clothing is a diaper, a onesie, and a gown or a sleeper, the one which covers the legs and the arms. You still can swaddle with a light blanket. Don't keep the room very hot. Keep a neutral environment. Nothing too extreme, not too cold, not too hot either. Number 3, feeding. Again, everything about our late preemies are immature. The concern with feeding is that these babies lack the proper coordination to feed effectively, to suck, swallow, and breathe. Since they have poor muscle tone, a late preemie baby tends to have a weak suck, has struggles with latching on the breast, and lacks the energy to complete a full feeding. It takes energy to eat. So if the baby works harder, then they burn too many calories and lose more weight in return. Therefore, an NG or orogastric tube is inserted into the nose or the mouth for feedings, and the baby remains in the neonatal ICU in this scenario. So moms, when this happens, pumping and manual expression of the breast is highly important as soon as after birth or as soon as when the baby is separated from you. The nurse will set you up with a double setup electric breast pump and will teach you how to manually express colostrum. This activity is critical in establishing your milk supply. Consistency is the key. Save all the colostrum and breast milk you can get to aid your baby in getting out of that neonatal ICU fast. Now, when your baby is able to feed normally, and if you choose to give your breast milk or formula in a bottle, the neonatal ICU nurse will teach you on how to pace feed your baby. You will find some videos about pace feeding in other channels on YouTube, so make sure to check those out if you need a refresher. Once you are home, keep up with the number and frequency of feedings your baby needs in a day. The baby has to be fed 8 to 12 times in 24 hours. Aim on the higher end of the number of feedings. Sometimes it is not feasible to stay on a certain schedule, like every 3 hours, because babies eat when they are hungry. They can eat back to back every hour sometimes, called cluster feed. And there are times they want to sleep longer because they are still full. My rule of thumb is as long as you don't let your baby sleep longer than 4 hours and you are meeting the required number of feedings in a day, ideally 10 to 12 times if you're breastfeeding, and at least 8 times in a day for bottle feeding, and that your baby's having adequate pees and poos in 24 hours, then I will say the feeding is going well. Don't wait until your baby's crying before you start the feeding, because crying is a late sign of hunger. Know how to recognize early hunger cues, like turning their head from side to side, trying to eat their hands, opening their mouth, and sticking out their tongue. Ideally, the breastfeeding session is successful if you start when the baby is calm, awake, alert, and engaged. Now, moms, if you're having trouble with breastfeeding or maintaining your milk supply, make an appointment to see a lactation consultant right away. Better yet, before going home from the hospital, make sure you have their number in your speed dial so you can get help as soon as you need it. If you're finding value in our video today, please click on the thumbs up button, as this will make a huge difference for our channel. Thank you and appreciate it. Going into number 4, infection. All babies, including full-term babies, have less immunity to illnesses, but babies born early are at higher risk for infection. There are other factors aside from prematurity that predisposes a late preemie to sepsis or infection, like if mom is GBS positive or has group B strep, if she has prolonged rupture of membrane, and if she has maternal fever, just to name a few. What are the signs if a baby has an infection? Low temperature, less than 97.7 degrees Fahrenheit or less than 36.5 degrees Celsius, and an inability to maintain an ideal temperature. Poor feeding, poor tone or lethargy, respiratory distress or breathing problems, low blood sugar levels and signs of hypoglycemia, pale or bluish skin or cyanosis, distended abdomen, and an inability to tolerate feedings. Know and learn how to recognize all these symptoms so you can report them to the pediatrician immediately. So, what do you do at home to prevent infection? Wash hands frequently with soap and water. Everyone in the household and visitors need to do this step because it is one of the best ways to stop the spread of any infection. Avoid taking your baby in crowded public places. I highly suggest keeping your baby at home initially, especially during the cold months, because of the widespread of viruses like flu and respiratory syncytial virus or RSV. If possible, avoid entertaining a big number of visitors at home. Avoid kissing the baby if you are feeling under the weather. Get your flu shot, moms and dads, during the flu season if you can, and also update your Tdap vaccine if you haven't gotten it yet. Moms, continue breastfeeding at least until your baby is 6 months of age. Number 5, low blood sugar or hypoglycemia. The baby's blood sugar will be checked periodically during the hospital stay, and once stable, the monitoring will be discontinued. Parents, you won't be asked to check your baby's blood sugar at home, so don't worry about pricking your baby's heel because it's not going to happen. What you will be asked to do, again, is to be familiar with the signs of low blood sugar. What are these? Baby's jittery, baby's cold, has low temperature, lethargy, poor feeding, poor tone. This is somewhat similar with the signs of sepsis or infection, so try to recognize the symptoms so you know when to seek medical attention. What steps do you need to do at home? Lots of skin to skin. Feeding every 3 hours or by demand, completing 8 to 12 times of feedings in a day, and making sure that with each feeding, the baby is getting enough breast milk or formula. Monitor the number of pees and poos in a day to gauge the adequacy of feedings. And call your pediatrician if you observe any signs of hypoglycemia. And moving on, number 6, jaundice. Preemies have a higher risk for hyperbilirubinemia compared to full-term babies due to a number of factors. One of them is ineffective feeding, leading to less passage of stools, resulting in reabsorption of the bilirubin back into the system, hence worsening the jaundice. But it's just one of them. You will find more information on hyperbilirubinemia on another video I posted, so check it out after watching this video. I will put the link in the description below. While in the hospital, the bilirubin levels are monitored closely, and so expect to have a series of blood draws during this time. If the bilirubin level is high enough requiring medical intervention, the doctor or the nurse practitioner will order and initiate treatment, immediately called phototherapy or exchange transfusion if applicable. What can you do at home? Make sure you follow up with a pediatrician and keep the appointment you made before leaving the hospital. The doctor will advise you when to follow up. Be familiar with the signs of hyperbilirubinemia, like worsening yellowing of the skin that starts from the face and extends downwards towards the whole body down to the toes. Lethargy, poor feeding, poor tone. Remember, the bilirubin level peaks at 5 to 7 days after birth, so make sure you're always on top of the feedings. Adequate and effective feeding plays a crucial role in keeping your baby hydrated and decreases the risk of bilirubin toxicity resulting in brain and neurological damage. If you're breastfeeding and you feel that your baby didn't have adequate feeding, make sure you manually express some breast milk, or you can pump and give it through a cup called cup feeding, or if you're not comfortable with that, you can put it in a bottle. Whichever way you choose, don't let your baby skip a feeding. Very important. If the baby skips a feeding and it's difficult to wake up for a feed, call your pediatrician and report it immediately. There you go, parents. That is the 6 main points you need to prioritize in the care of your late preemie. If you find this video helpful, share it with your friends who also need this kind of information. Be well, everyone. Make this day count. And as always, happy watching!